you want consumers to be able to know their information, know their data, to be able to feel comfortable going on ChatGPT or Gemini or whatever their preferred LLM is, and look things up and ask questions. I think the common question I get a lot is, are you worried about it hurting the business? We really are not. What we've seen it is actually expand the funnel, because at the top of the funnel is you have people that are more engaged, who ask more questions, who want to know what their numbers look like and look things up. But as you go down and through that decision tree, ultimately, for many people, the decision becomes, or the advice on the LLM becomes, you need to see a doctor. And that person, that 35-year-old, that 40-year-old, whoever it is, who gets to that point where the recommendation is you need to see a doctor, are they now going to wait 3 months, 8 weeks, 12 weeks to get in to see a primary care provider? Who can see them today? Who can see them tomorrow?
Try to fix the current system or reimagine something new. Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the change is permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the Week about the Nourishing Change conference. How did the conference's attendee mix reflect the collaboration that needs to happen in order to make healthcare more preventive? And how much progress is possible if you and I join the movement? I'll talk about that. Then Payam Zamani, CEO and founder of My Doctor Now, shares how you don't need urgent care if you do primary care right, how outcomes improve when you make it easy for patients to be compliant, and whether he thinks patients using LLMs are good for business. I'm Jared Johnson. Let's get it. Flava of the Week. If the Nourishing Change community has anything to say about it, prevention isn't going to be stuck at the margins for much longer. That was a rallying cry I heard throughout the recent Nourishing Change conference in Des Moines, Iowa, and I left feeling more hopeful about preventive health actually working than I have in a long time. The conference was hosted by Kroger and Hy-Vee grocery chains, and it highlighted how improving health outcomes requires a much broader coalition than health care alone. The event brought together providers, payers, retailers, government leaders, tech companies, food brands, academic institutions, community organizations, and notable players in fitness, longevity, and wearables, all around a shared belief that health is influenced by a lot more than clinical care. Topics ranged from interoperability and new payment models to food for health and workforce development, and all reflected a growing movement toward collaboration across traditionally separate industries. Another recurring theme was that these stakeholders are finally including both economic and clinical outcomes when they talk about prevention. I attended sessions on how nutrition, retail health, pharmacy, health plans, and yes, even PBMs can improve outcomes while lowering costs. What's the consumer lens? Many of the conversations and sessions at Nourishing Change were built on a belief that grocery stores, pharmacies, and other retail settings are becoming healthcare's new front door, creating opportunities to engage consumers earlier, influence healthier behaviors, and shift the industry from treating illness to supporting long-term wellness. As many of you know by now, I've long been fascinated by what healthcare can learn from retailers. I've also thought it ironic for a long time that when brands have been built around knowing and empowering customers start talking about health, consumers pay attention while the majority of the clinical world rolls its eyes. And I get it. Believe me, I've been there. We need all of the innovations that are focused on sick care, and we need that optimization to happen. But if we want real progress, we have to get everyone at the same table. Health and health care. Treatment and prevention. So in many ways, this conference lived the change that I want to see. Prevention has always been at the margins, but it's time to change that. It's a movement that will take all of us because everyone has a stake in proactive health. This conference was a great start. Now imagine what can happen if you and I take this baton and run with it. Once and for all, let's drop the silos that healthcare is built around itself and be the torchbearers for cross-industry conversations and relationship building in the name of making preventive health an economic and clinical reality. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the Week. All right, everyone, let's get into the flow. Please join me welcoming my guest this week. I'm here with Payam Zamani. Dr. Zamani is the CEO and founder of My Doctor Now. We have a lot to dig into. Dr. Zamani, welcome to the podcast.
Well, Jared, thank you so much for having me today. It's great to be here with you. My Doctor Now is a really unique model. It's a company that I started while I was still in residency a number of years ago. And while I was in residency, one of the things I noticed was it was so difficult for our patients to be able to get in and get seen with their primary care providers in a timely way. I would talk to the clinic operations manager on a regular basis, and I would say, our clinics are open Monday through Friday, 8 to 5. And she'd say yes. And I'd say, but most people work Monday through Friday, 8 to 5. And there was no other thought process that progressed after that. And, back at that time, it was pretty obvious that the world was moving in a direction of what we call today now, the now generation, the now economy, where everything is made available in a much more easy and simple way. You can buy something on retail and have it shipped to your door the same day or next day. It's food delivery, it's transportation and ride sharing, all these services, and banking even is available on your device. So everything has been made more simple and easy except healthcare. And the thought was we can do a much better job making primary care services ridiculously easy and delivering the services in a manner that makes sense, in a manner that's more consistent with how everyday people live their lives. And that's what My Doctor Now set out to do. So My Doctor Now are family medicine offices. We like to think of them as the ideal medical platform. And, since then it's transformed and evolved into really an operating system for primary care, where we have multiple delivery channels for healthcare services. One, we have clinics that fit within your lifestyle. They're open 7 days a week. They're open early. They're open late. But really the groundbreaking thing with our clinics is that we figured out a way to provide primary care services on demand when you want them, when it makes sense for you. So yes, of course, for example, you can do it the traditional way and you can schedule an appointment for today or tomorrow or 3 months from now. But what really makes My Doctor Now unique is you can walk in whenever you want for anything you go to a family medicine office. 7 days a week on your schedule. So if you get off of work at 6 p.m. on a Wednesday, you want to walk in and get seen, you can do that. If you want to go on a weekend or a holiday, you can do that. If you have an issue that has come up last minute, you can get in to be seen at My Doctor Now 7 days, whenever it makes sense for you. So it works better for working families, people with busy lifestyles, and, within a manner that, again, I think most people have gotten accustomed to. We have a second line of service, which are house calls, where we go out. It's care at home. It's become very important. Again, in today's modern day, I think people expect to have some services rendered to them at home, and we call them house calls. And that's been really a wonderful success for a number of different demographics. And then, of course, the third channel for us is virtual. We provide care on your device in a manner that makes sense. So, if you take a step back and you think about what My Doctor Now is and this platform that we've created, it's multiple delivery channels of healthcare made accessible and convenient to you on your terms in a way that makes sense for you. It might be virtual, it might be at home, it might be in a clinic. Clinics, we've worked very hard to make ubiquitous. We're on our 75th site. 60 of them are in the Phoenix metro area. So you're never far from a My Doctor Now location, and you can have access and connect with a healthcare provider on your terms when it makes sense for you.
It's fantastic. And thank you for clarifying too about the difference between this and what traditionally people would think of as urgent care. It's essentially a completely different approach here and involves a lot more modes of care from the way you're describing it here. I imagine that's one thing that led you to become the founder of what is now, what'd you say, the 70th location?
75th location.
75th.
And so I think, it's easy to confuse My Doctor Now with an urgent care facility, except our scope of services is so much bigger and and more comprehensive. Urgent care, as you know, is there for acute and episodic issues. But the way we've always looked at it is if you do primary care right and you make it accessible and you make it customer centric, then you don't need an urgent care. If you can get in to see your primary care provider whenever you need, whether it's for chronic issues, it's for preventative issues, and of course for acute and episodic issues when something goes sideways and you get hurt or injured or you're just not feeling well, then you really don't have a need for urgent care. So we really see that acute and episodic care as a component of primary care done correctly. But it goes beyond that as well. We live in a value-based world where outcomes are important. And the truth is that when you make healthcare ridiculously easy, what you're really doing is you're making it really easy for patients and individuals to be compliant. You're making it easy for them to get in and get the care that they need on their terms when it makes sense for them. So outcomes improve. People are more engaged. They're more empowered. You want consumers to be able to walk out of a medical facility and think, I can do this. I got this. Getting on top of my care and turning things around is something that's doable. So I think that empowerment is important, that engagement is important, and that's why outcomes improve. Additionally, the cost of care becomes less downstream. Again, when you make it easy, you make it simple, and when patients and members of the community know they can get in to be seen at any My Doctor Now facility whenever they want, 7 days a week, they are much less likely to use not only urgent cares, but of course, avoidable emergency room visits drop, hospitalizations decrease, readmission rates decrease. So you really are able, from a cost containment perspective, able to lower costs and bend the cost curve more favorably, while simultaneously getting better outcomes.
I see. So let's dig into that model a little bit, kind of the economics here behind it. Clearly, that's something that you've figured out to some degree. I mean, for how much you've been able to scale the number of locations and the number of services. What's the basic approach with your model? What's the split between, cash pay, commercial pay, patients? How do you make the economics work?
So being customer centric, first of all, it's important to us to be able to see every member of the community. So from a payer perspective, we work with all payers. We have great relationships with payers. Of course, Medicare, Medicare Advantage plans, Medicaid, and all of the commercial plans that at least we're aware of. We want to make sure that we're in network. We accept those plans and patients, irrespective of who their carrier is, we can get them in and get them seen. We, of course, have self-pay prices as well. Our self-pay prices haven't changed since we launched My Doctor Now a number of years ago. Price transparency has been very important for us. We also have our own discounted health plan, which allows those that for whatever reason are unable to have access to primary care or health insurance to be able to really better plan for how their healthcare dollars are going to be spent. So to answer your original question, roughly 5 to 10% of our patients are PVP, meaning private pay patients.
Nice. Well, I'll tell you, I mean, coming from the cash pay side of healthcare anyway, which is an area that we focus a lot on this show to help people understand what their options are, to be able to feel comfortable and trusting of an option that is nearby them. There are a lot of options, and the fact that you mentioned that you're not just raising prices constantly, that you haven't changed prices for a long time, the price transparency is important. That's very encouraging. I mean, there's a lot to that, and I see a lot of value in that. Now you're focused, like to your point, a lot in Arizona and the Phoenix metro area. Do those economics change in other areas, or are you still kind of focused in urban areas or like metro areas? Like, does it change to open a clinic in a rural area, or does it even make sense in a different type of demographic?
Well, we really like concentration. First of all, going back to the PVP pricing, one of the things we identified early on was you need price transparency. You need to know how much things are going to cost before you go in to see a healthcare provider. There shouldn't be any surprises. And the old way of doing it where, patients would go in and get seen and the physician would bill something out as a 1.3 or a 1.4, and there'd be some sort of a self-pay price associated with it. Patients never knew. So, our approach was very, very consumer-centric. It's one price. It's displayed. Everyone knows. All of our services are displayed along with a price. So you know exactly how much things are going to cost. And by the way, we are starting to see that part of the business grow over time. We are seeing consumers become a little bit more wise about how their healthcare dollars are spent and looking at what their options are, especially with high deductible plans. Many consumers are now starting to pay for things out of pocket because they find it's more affordable and they have more options. And overall, it works better for many people. Which is what led us to, we call it the P10 plan. It's $39 a month and they're $10 copays. And we launched that a number of years ago, and the patients can be seen for anything they go to a primary care doctor's office for, again, for $10 copays. And I just can't explain to you how important that's been for so many families and individuals and young people who, for whatever reason, don't have access to healthcare, or the options for them are just don't make sense. And they've opted to go with our P10 plan. But, that aspect of the business is we are starting to see more traction with it and seeing it grow. But, to talk a little bit more about the economics of the business, yes, we're expanding into other geographies. We're in the Texas market now, and we're the largest primary care group in Arizona. In fact, we're the largest in the Southwest, but we're expanding into the Texas market, initially starting in DFW, Dallas-Fort Worth Metroplex, and then simultaneously expanding into Austin and Houston and San Antonio as well. And we're following the same trajectory, which is we make concentrated bets. We believe that the clinics should be ubiquitous. That is what allowed us to have total market dominance in Arizona. It's the brand recognition, it's the community knowing who we are, what we do, that there's a better option available to them. And much of our growth has come from word of mouth. When we open a clinic, in fact, we spend very, very little on marketing, advertising, and customer acquisition costs are very, very low. It really is all word of mouth. And when we open a clinic, within our first full month of being open, we hit operational break even.
Wow.
We have full payback within 6 to 9 months. Our clinics ramp up very, very quickly. And so far, what we've seen in new geographies, it has not deviated from how the economics have historically worked. Of course, fee schedules are different in new geographies, but the economics have been very consistent. One reason for that is we spend a lot of time and effort on standardization and centralization. When we open a clinic, it's the same model. It's something that we can replicate, we can duplicate, we can scale. We can tell you exactly what that curve is going to look like as that clinic ramps up and as it grows. We know what the economics are going to look like. But, all of that took a lot of work. It took many years of effort to standardize it and centralize it and to be able to have something that we can replicate. But much of the inspiration for that was the branding aspect of it. When we started, there really weren't many primary care groups, and you could argue any primary care groups that had scaled and branded primary care platform and done it successfully. And some of the efforts that had previously been made were maybe employer sponsored with One Medical, for example, which got acquired by Amazon. And what our objective is we're going to create this platform that's available to everyone in every community. And again, have those clinics be ubiquitous, have them be spread out, and be able to reach mass populations by our reach and our effort and just the clinic locations and the geography.
Amazing. Tell me how the experience for the patient is unique once somebody walks in the door for an in-person visit, especially anything that might be like a digital touch point that they can expect to encounter. What does that experience look like?
So, that customer experience is so important to us. It's the core reason why My Doctor Now was started. The whole perspective of accessibility and convenience goes back to that effort of looking at it from the customer's perspective, the consumer's perspective. And if you think about, every aspect of that, and you think about where traditional clinics were placed in medical office buildings where people are not familiar, they look different, they feel different, they even have different smells than most buildings that we're accustomed to. So we took all of that in perspective. Why? Because really one of the important aspects of delivering a better experience are removing the psychological barriers that first exist. So you have to place these clinics within areas that people are already familiar with. We love going in grocery anchored centers where people have a tendency to already go 2.48 times a week. They're familiar with it. They know the parking, they know the drive, they know how to get there. They've been there hundreds, if not more times. So psychological barriers removed. The parking is something that they're familiar with. The sights, the sounds, the smells. They can walk into a clinic in a really easy manner. And then from there, of course, everything else is digital. It's the check-in process. We use Epic as our EMR system. And with my chart and with Epic, really everything can be done right on your phone before you get there. So once you're there, it's a click of a button to check in. And as I mentioned earlier, our clinics are standardized. It's the same feel. There's a sense of familiarity. You want that there. You want consumers to know, irrespective of which clinic they've chosen to go to, that it's an environment that they're comfortable with. Of course, patient transit times become important, especially if you're seeing patients that are not scheduled. And we look at that very, very closely. We're able to get our patients in, follow our protocols, irrespective of visit reason. So, when we talk about family medicine, primary care, we're talking about pediatrics, we're talking about adult medicine, we're talking about senior care, we're talking about women's health, behavioral health, all available in one facility. And of course, as I mentioned earlier, acute and episodic issues as well. But we're able to get our patients in and out and through our doors, door to door, 45 minutes. For unscheduled appointments. And of course, scheduled patients can have even better transit times than that. But it's all goes back to the technology. It's what happens behind the scenes. It's deleting as many steps as possible. I think that's something that's overlooked in healthcare. I think both from a technology perspective and, of course, more specifically for healthcare, there is this mistake that's commonly made where there's a tendency to add more steps. Our approach has been very different, which is what can we delete and get it down to a bare minimum? How do we remove steps out of this equation, which are absolutely not essential to maybe the check-in process or the consumer experience, and really make the process more efficient, more consumer friendly?
I wanted to ask also about a trend maybe you're seeing, maybe you're not. I would guess. I mean, there have been stats that have just come out this week about the percentage of people in America, at least, who have asked health related questions to ChatGPT, Claude, whatever. They're pretty astounding numbers, and they've more than doubled in the last 12 months. Are your patients seeing that? Are they coming in like asking more with more info that they've been armed with by asking ChatGPT or some other AI app before they're scheduling? And if they are, is that changing how providers are responding to that?
I think it's so important. I was just having this conversation with someone else yesterday. We don't know exactly where healthcare is going to be in 20 years, but I think patient empowerment is such an important aspect of consumer-driven healthcare. So we love all the AI devices that are available. I think patients need to know their metrics. They need to be empowered. A 35-year-old who knows what their hemoglobin A1C is, much less likely to get type 2 diabetes as they get older. And they're much more likely to stay on top of their cholesterol if they know where their numbers are today when the numbers are good. And you want them to be able to go look things up and ask questions. That empowerment is so important. And really what we're talking about here is the commoditization of information, of diagnostics, irrespective of where it originates, whether it's from a device or whether it's from lab work that was done. You want consumers to be able to know their information, know their data, to be able to feel comfortable going on ChatGPT or Gemini or whatever their preferred LLM is, and look things up and ask questions. I think the common question I get a lot is, are you worried about it hurting the business? And we really are not. What we've seen it is actually expand the funnel, because at the top of the funnel is you have people that are more engaged, who ask more questions, who want to know what their numbers look like and look things up. But as you go down and through that decision tree, ultimately for many people, the decision becomes, or the advice on the LLM becomes, you need to see a doctor. And that person, that 35-year-old, that 40-year-old, whoever it is, who gets to that point where the recommendation is you need to see a doctor, are they now going to wait 3 months, 8 weeks, 12 weeks to get in to see a primary care provider, who can see them today? Who can see them tomorrow? And in every community that we're in every community that we service, the answer, without a doubt, is My Doctor Now. We're there to provide them with that service. We're there when they need to be seen today or when they want to be seen today. We're the only primary care group that is able to do that 100% of the time consistently and provide them with options, whether it's in a clinic or on their device or at home. It really has been very favorable for us.
The thing that's clear to me is that you can't tell people to stop asking the questions. Millions of questions are being asked already. You can't stop people from doing that. Just like we couldn't tell people to stop asking Dr. Google, no matter how many times it was shown to be not the best information, it doesn't matter. People are going to ask anyway. So it's not like it's not an either or. It's understanding what the behaviors are, what you can control, and being present in the right ways. I mean, that's a much better strategy, I think, to your point, of being available for people when they need the care. So I'm totally with you on that. And I'm totally with you on just this whole approach to primary care, the availability, the transparency, the multimodal nature of it. There's a lot to that. And as I wrap up here, I just had one more question for you, which is more to speaking to your fellow founders in the space, to your colleagues who might feel an inkling of an idea as well. Maybe it's not in the primary care space, but it's somewhere in healthcare where paying attention to the patient experience will help them, or maybe they're trying to improve an aspect of it. From your own founder journey, what's your advice to fellow founders in this space who do want to make a difference, who do want to provide a better way of offering healthcare?
There's so many things I could answer that with, but I think, to piggyback on what we were just talking about, I think there's an underlying theme here, which is do the right thing for consumers, do the right thing for patients, make decisions that are in their best interest. And, whether we're talking about AI and LLMs and access to information and encouraging them to be educated and empowered and engaged in asking questions and looking things up. That's in their best interest. That helps. That's important. Or to the services that you provide, design a system that helps the consumer, that makes their life better. That solves a real problem. I think that's what we set out to do. It was incredibly important, and it remains very important for My Doctor Now as we continue to grow and expand. Do the right thing for the consumer and for the patient, and I think you'll have so much clarity as you continue to grow. I would add a couple other points. Focus becomes more and more important. Staying focused on what you're working on, avoiding the distractions, and of course, challenging assumptions that everyone else already treated as facts. I think in healthcare specifically, there are a lot of assumptions that are made that we assume are true, that are passed down from generation to generation of healthcare professionals, where you can start poking holes in. And you can start figuring out, why is this true? Does this remain true? And is there a better way of doing it? And I think if you follow those simple truths, you're probably going to end up doing fairly well.
Dr. Z, it's been a pleasure. Thanks for joining us today and giving us so much to think about. Thanks for everything you're doing to make healthcare more consumer-centered.
Thank you. Thanks for your time. It's been great.